Hi, I'm Dr. Ed Weisbart. I'm a family physician in St. Louis, Missouri, and I chair the Missouri chapter of Physicians for a National Health Program. You probably know our group, Physicians for a National Health Program, is a nonprofit 501c3 nonpartisan group that focuses on educating and research and advocacy around the policy of single payer Medicare for all. In this discussion, we're not going to talk too much about Medicare for all itself, but instead we're going to talk about how to communicate about Medicare for all. So we'll try to find ways to communicate on this somewhat controversial topic and have that resonate with liberals and conservatives across the political bounds. So that's our goal today, is to help people understand how people think from a liberal and conservative perspective and how to tie that into policies. We'll use Medicare for all, of course, for the example. I have about a handful of different frames of how people think that we will walk through, different models that we'll walk through, but we will make a point to emphasize how exactly to apply them, how to alter your words in a few ways that make the policy the focus and not the political posturing. So to start with, I just want to point out that the words we pick matter a lot. Here's one study that came out a few years ago looking at a subtle difference in words and what a big difference that can have on outcomes. So this was done right around the time of the 2008 presidential election, and they called a few hundred people who were frankly likely voters, so the numbers are high, but frankly likely voters, they're registered and had other likeliness of voting, and they asked them one of two questions a couple days before the election. They asked them, how important is it to you to vote? And then a random other group was asked, how important is it to you to be a voter? A fairly subtle difference. Takes no longer to say one or the other. How important is it to you to vote versus how important is it to you to be a voter? And then they went back a few days later and asked them, so did you vote? And it turns out that the group, again, likely to vote, when they were asked how important is it to you to vote, 82% of them say that they did vote. With this one small difference in words, how important is it to you to be a voter, that number shot up to a remarkable 96%. So this, I think, makes my point that a small difference in words that takes you no extra time, but if you're thoughtful about it, can make a big difference in how you do. Pronouns are also terribly important, and there's a number of ways pronouns can be used, but one that I want to call to your attention is the use of, for example, the word I. The word I implies personal ownership. I personally have been actually tricked by salespeople who know this game, and they use the word I a lot. I had a salesperson who came into my house and said, I will build your HVAC system for you. I will put in this exhaust. I will do this and that and the other. And I was thinking, this is great. We must have like the business owner talking to us. And of course, it turned out he was just one of the salespeople. And as soon as we signed the contract, he disappeared. But the word I is a very powerful word to use, and salespeople know this. The word we can be a little bit less powerful. It's amorphous, it's distancing. And to some people, when you say we too much, it sounds like the big state. It sounds like big government. It's less personal. And lastly, though, I want to call your attention to second person personal pronouns. They are very engaging, and I'll bet you already know that. Get it? That's how Rush Limbaugh does that a lot. You're welcome. I spent about 6 months listening to Rush Limbaugh for 5 minutes twice a week, and I studied his techniques, and he is very successful at this. And I've recently discovered that actually Michael Moore does this same thing on his podcasts. Second person personal pronouns. You know this. You already know this. You're smart. You're one of our listeners. You get this. You already know that. And second person pronouns engage people more. If you're listening to a speaker using these second person pronouns, you get brought into the inside of the discussion. So this comes up quite a lot lately. And if you think about it, the worst possible way you could use pronouns is to say a phrase like this: let me explain this to you. Well, that's really distancing. That's setting up yourself as someone who knows more, which perhaps you do, but that's a lot of people hearing that phrase, let me explain this to you, feel very off-put by that. Rush Limbaugh wouldn't say that. He would say something like, you're smart, you know that, and get to the same kind of a point, actually probably the opposite point, but be thoughtful about how you use your pronouns. Also, be thoughtful about how you frame a question. So this is a bit contrived since we're not actually in person, but you could play this game where we're going to toss a coin, and heads, you decide if you're going to play. But the game rule would be we're going to play once, and heads, you're going to lose $100. You're going to pay me $100 if the coin toss comes up heads. If you actually want to agree to play this game, you need to obviously be able to expect to win something on tails. So that's the question. Heads, you pay me $100. Tails, I pay you something. How much does tails have to be for you to actually say, you know, yeah, I'll sign up for the one round of this game. I'll play this. Heads, you lose 100. How much does tails have to be worth? Ask yourself that question right now. And I'll tell you that the typical answer is $200. Most people wouldn't engage in this unless they stand the chance of gaining twice as much as they are likely to lose. So this has been done in a variety of cultures and societies, in non-financial societies where it's been done with goats and sheep. And it turns out that losses are roughly twice as valuable as gains. And you can think of this in your own life and in other ways too. Imagine you were picking a surgeon and you had one surgeon that said that she had a 95% chance of success. And you were comparing her to another surgeon who said that she has a 5% chance of failure. Now, you know, arithmetically, it's the same exact thing, but the inclination is that you like the one that's got a 95% chance of success. That's called loss aversion. These are both called loss aversion. You don't want to lose something you have. Of course, in surgery, we're often stuck in this situation, but that's loss aversion. How do you apply that to Medicare for All? Well, we are trained and experienced being comfortable in a gain-centric world, and we're not so comfortable in a loss-centric world. So in your life, you typically try to say things like, well, you know, with Medicare for All, you could save money for the other things you want. Well, the loss-centric, and I would argue a more powerful way to say this, is you are wasting your money today. So gain-centric, save money. Loss-centric, stop wasting your money. One is twice as potent as the other. Gain-centric, you could go see any doctor you want. Loss-centric, people are taking away your choice of doctor. Don't let anyone take away your choice of doctor. Gain-centric, loss-centric. Gain-centric, live longer and healthier with Medicare for All. Loss-centric, we shouldn't have to die younger than we need to. You shouldn't die younger than you need to. So think about how you frame a message and you'll get to the same place, but it's different. Another model I want to tell you about is from this guy, Manny Elkind. He came up with this model he calls the whole brain model. And he says that we each of us have one of 4 different ways of thinking, one of 4 different quadrants or comfort zones in our head. And of course, we all have all 4, but we have 1 or maybe 2 that we are the most comfortable with. And this is very relevant to how you communicate any message, but certainly Medicare for All. So one quadrant, some people are really focused on the facts. They want to know the efficiency, the numbers. They want a quantitative, fact-based argument or answer. But another group, that's not really the compelling thing. You can have all the facts you want, but if you don't have a method or a way you're going to control it or regulations or describe the policy more, the form of it is more important for another group. A third group is really accepts all of that kind of stuff, but is much more motivated when they understand the future. If you don't tell me where you're trying to go, I can't relate to it. I get that you have a way of doing it. I get there's all these facts and numbers, but what are you doing with all this? Why are we doing this? Where are you trying to go? And then a fourth quadrant is more about the feelings, the relationships, the human face on the story. And it's really important to pay attention to which quadrant your person you're speaking with is in. If you're talking to one person, you want to kind of think about where that person is on this quadrant list and make sure you're not just answering their concerns from your comfort zone. You want to think of their comfort zone and think of which one of these 4 is the most potent for them, and then formulate your answer within that. If, on the other hand, you're talking to a large group, and you probably have someone from every one of these quadrants in your audience, with a large group, what you want to try to do is sort of circulate around these 4 quadrants, roll around the 4 quadrants, look at your slide deck, look at your lecture outline, and make sure that you've got something from each one of these quadrants coming up every few minutes. If you'll notice, some of the best writing in journalism makes a point to do this. So how do you apply that to Medicare for All? Well, under the facts quadrant, that's PNHP's strong spot, right? Physicians for a National Health Program is our members are often the authors of many of the important facts. And so we're really focused on them sometimes. And My point is that that's sometimes the compelling argument, sometimes not. So think about the facts you're going to use and listen and whittle it down to the ones that are the most competitive. Try in general to only take your best shots with the facts. Don't overload with facts. In forms, some people are really impressed when you're talking to them to think about, well, you know, we have Social Security. Why not just make Medicare for all be a benefit you get like Social Security? They find you, you know, you sign up at birth for Social Security. You have the same number your whole life. You turn 65 and they find you and start paying you Social Security benefits. Why can't that be healthcare right from birth too? For some people, thinking of it on that simple of a basis is transformative in how they can accept the idea. And then, of course, nowadays we have 2 live bills in Congress. There's a bill in the House, there's a bill in the Senate. They both got lots of co-sponsors. And for some people, just knowing that there's actual legislation in both chambers of Congress makes the whole thing change from a really interesting model that the academics have thought up to, oh my gosh, if we pass one of those bills, we could actually have this happen. So for some people, the form is really important. Bring that up to them. Others, of course, need to know where we're going. So there's no shortage of ways to describe a better future because it's a remarkably better future. But be sure you don't stay silent on that. Describe where it is we're trying to go. And then lastly, of course, there's folks for whom the feelings have to be included. You have to have a personal story. You have to have anecdotes. You have to put a face on the thing we're talking about. And if you do that, of course, you want to be sure to connect the dots of how does this story connect back to the policy. So think about this model. And when someone's asking you a question, if they tell you a story about their uncle in Canada who was on the waiting list for back pain and they had to wait so long that they had a heart attack and they died, your answer must be consonant with that quadrant, right? The right answer would be something like, oh my God, that's a horrible story. And your story reminds me of somebody in my family who had such and such. And then tell that story maybe, and then wrap that up with, you know, we're both right. Neither of us should have that problem. Nobody should have that problem. And that's why this policy. So that would be a good answer to the, what about my uncle story? A bad answer, which I confess I have made, to the what about my uncle story is, well, life expectancy between the 2 countries. Well, here's the waiting list data for the 2 countries. No, somebody comes in with a personal anecdote, a story, a thing that they experienced. You have to stay in that quadrant, at least at first, and you can't answer a human feelings concern with a fact-based answer. And likewise, if you have someone who raises the question about waiting list data or about cost data, you can't answer that kind of concern with some anecdote suggesting that the human tragedy of what we have today, which is incredibly real, but you can't answer a concern about cost with going back to the human tragedy and a pain and suffering story. You must have an answer that addresses the content of what they're going on in that quadrant. So think about that. You probably have your own quadrant in which you're the most comfortable, and make a point to not be trapped within your own quadrant. Think about to whom you're speaking. I want to tell you about a sociologist by the name of Arlie Russell Hochschild. She's, I believe, in California, and she was perplexed by these issues herself. And she wanted to understand why it is that it seems so often in our country, people are voting against what many people would think is their own best interest. Why is it that so many Americans vote against our own personal best interest? And so what she did is she embedded herself in an oil region of Louisiana and became friends and got to know a lot of these folks and interviewed them and developed some pretty respectful insights into what she says are 2 different narratives of how we view the world. There's a liberal sub-narrative that guides how a lot of liberals think, and there's a conservative sub-narrative that describes how a lot of them think. And the bottom line answer to this is to simply respect that difference. But let me walk you through what that is. So she says that these deep narratives for a liberal tends to be something on the order of, we built this wonderful public square. We're proud of this public square, all the common good that we have here, we built it and we're proud of it. And we see marauders at our gate invading our public square, dismantling our public square, and using our public bricks to build their McMansions. So that's kind of the deep narrative behind you're destroying our schools, you're doing this, that, or the other thing. There's a deep narrative of pride in the public square, and marauders at the gate are dismantling it. So we are angry, liberals say. Conservatives have a somewhat different deep narrative. They say that we are proud Americans. We are very proud Americans. And part of what that means is that there's this American dream out there that we've been promised, and we're waiting in line for it. And we're frankly proud of the fact that we have the patriotism that makes us wait in line patiently for our turn at the American dream. So we're proud of how patient we can be waiting for the American dream. And then we see that our line itself is not actually moving. And we wonder, well, why is it that now, 10 years later, I'm no closer to the front of the line where I can get me a piece of the American dream? Why is that? And we look around and we see that there's people from the back of the line who should also be waiting in their place as we have been. And they're being allowed to cut in front of us in line. So of course we're not moving because people from the back of the line are cutting in the front of the line. And they're not doing it on their own. No, the government is escorting them from the back of the line to the front of the line. And that just rankles some folks. So what she concluded is that economic self-interest is never entirely absent, but frankly, what she discovered was the importance of emotional self-interest. So if you ignore the narrative and you only talk about abstract data, you're not going to be addressing the real life frustrations that so many people have on either side of the equation. Let me introduce you to George Lakoff. He was actually the first author I read that started to explain some of this dilemma to me. He's a neurolinguist from Stanford, and he's got a number of books, but the one that I think is the most compelling is this book called Moral Politics, and I would recommend it to you. And what he says, these are his words, not my words, but his words are that there's one of two models or frames, he says, in all of our brains, and it's largely related to how we were brought up and such. But he said there's either the nurturant mother model or there's the strict father model. Again, his words, and this is based on how you were raised. So the nurturant mother is one who is a model that emphasizes equality and diversity and a helping hand, and that this is what we relate to, and this is, of course, the more liberal approach. The strict father model, on the other hand, is one that's very hierarchical, and I believe the hierarchy that he talks about is very clearly spelled out as God, man, woman, child, animal, plant, rock, with variations within that according to color and other socioeconomics, but a hierarchy, and that disrupting the hierarchy is damaging to the moral survival, to the survival of civilization. It's essentially social Darwinism, that the people at the top deserve to be at the top, and that you preserve this structure through having consequences for your action. I'm here to tell you, I've had many conservatives tell me that this is not theoretical, this is exactly how they think. And of course, that's the conservative model. So both of these models are quite different. But the point is that there's a group in the middle that has both models, that both frames are active in their head, and their policy specifics may vary, but they wind up looking independent. And that's actually the larger group when you look at the numbers on this. So 20% of Americans only have the nurturant mother model in their head, according to Lakoff and others who have validated his model. And 20% of Americans only have the strict father model in their head. But that the current encouraging part is that, frankly, 60% of Americans, and probably of human beings, but 60% of Americans have both of these frames in their head. Great, okay, thanks for the model. How do we use this? So I would tell you that it's very useful. I used to say, if you find somebody who's only got the strict father model, just walk away, but that's not what I would tell you. So if you're talking to a liberal, somebody who has only the liberal model in their head, then the job then is to fill in gaps of information and mistakes and kind of help them understand the detail better. But to try to push someone who has only the liberal frame, try to push them towards commitment and action. You know, call your legislator, sign this petition, join our group, some action. They're ready, they're pretty much ready for action. Conservatives, on the other hand, there's ways you can talk about this with conservatives that are just as resonant. Personal freedom, you know, don't let somebody take away your choices. Consequences, imprudence, stop wasting our money. So more specifically, this is the group for whom the idea, don't let anybody take away your choice of a doctor, is particularly important. Or talk about something like dialysis, whereas, you know, once you get into dialysis, you also get Medicare. So the country ponies up the, what is it, $75,000 to $90,000 a year to pay for your dialysis. Well, if you're if you think that's something that we should continue to do, and almost everybody I talk to says yes, well, then I would think the most prudent thing to do is to prevent dialysis, to prevent kidney failure. And so many people wind up in kidney failure because they can't afford their insulin, or they can't afford to take their blood pressure medications as regularly as they should. So if we're going to pay for dialysis, let's be more prudent and delay the need for dialysis by making sure insulin and blood pressure meds and such are more available. And then lastly, for independence, this is where the model really comes into effect. When you identify somebody that has both of these frames in their head, that's where your anecdotes become really important, because what you want to do early in a story, early in a discussion with somebody who's more independent, is wake up the nurturing part of their brain. You know, talk about a story, ask about their aunt or their grandmother or their kids, or tell about your family member or friend, or some story that starts activating the nurturing frame in their head, and then show the relevance of this story, of course, to the policies at hand. I'll introduce you to Jonathan Haidt. I think of him as Lakoff 2.0, although both he and Lakoff would probably be offended by that. But Jonathan Haidt is sort of the next level of this in my mind. And he's got this terrific book called The Righteous Mind. And he's done online surveys at the time of the book of 132,000 Americans. I believe now he's north of 200,000. And he's done these online surveys that did two things. Number one, it identified what he calls moral pillars. So he identified 5 moral pillars, which I'll explain to you. And then he also assessed where individuals are on the political spectrum, from all the way to the left to all the way to the right, and assessed where your politics correlate with your support for these moral pillars. So first of all, what are the moral pillars? There's pages and pages in his book about each one, but they are, and I picked a few words to describe for you, but they are essentially what the word sounds like. So one, he says, is fairness. Another, he says, is caring, then loyalty, authority, and sanctity. And you can read those words right there, but I'm not going to read them more to you. But basically, those are what he calls the 5 moral pillars. And then he scores everybody on the surveys about how much these values are important to them, or how much they might reject them, and compare that to where they stand politically. So here on the slide, you're seeing on your left, very, very liberal, and on your right, very, very conservative. And you can see that very, very liberals scored very highly on the moral pillar of fairness. That probably doesn't surprise you. Very liberals really score highly on the value and cherish fairness and caring. And they don't reject loyalty or authority or sanctity, but they certainly don't endorse them nearly as strongly. So that's the very liberal point of view, according to his assessment. And on the other side of the slide, you see the very conservatives who, frankly, don't score as high on the moral pillar of fairness or caring, but they also don't reject those values, but they don't score as high. But they score these other moral pillars significantly higher, materially higher. So they have moral pillars too, but a different mix of them. So if you're standing on the left as a very liberal person and looking all the way to the right, you see a lower score on fairness and caring, and that's all you see. And you think that the side on the right, the very conservatives, are heartless and don't care. But people all the way on the right see almost no resonance with loyalty, authority, and sanctity, and see very liberals as amoral and a problem that will destroy society. And of course, both sides are right and both sides are wrong, but both sides act as if they have the sole franchise on the moral high ground. And both sides are offended when somebody implies that about them. So how do you apply that to our issue of Medicare for all, in particular, the issue of universal healthcare? So fairness, that's where the phrase healthcare is a human right comes in, right? And caring, that's where the protect the vulnerable stuff is. And we're gonna come back to this near the end, but basically these are the 2 values that most resonate with the liberal side and most help you bring out the base. So if your goal in a discussion is to bring out the liberal base, then yeah, emphasize fairness and caring as the content of what you're speaking to, but do not expect a strong argument about fairness and caring to be persuasive to conservatives. If your goal is to reach broader than your base, that's not the way to get there. So liberals often love to put up memes like this, right? Looking at these massive salaries and railing against them as unfair, right? And when liberals see these numbers, we think that's just not fair and it's violating one of our moral pillars. But when conservatives see those numbers, we think of it completely differently. We see that as, well, they earned those numbers. They're the job creators. They work hard, or whatever. So the point is, they're not thinking that is a violation of a moral pillar, and you're not going to get anywhere when you're trying to persuade very conservative folks that these salaries are too high. It's not going to go very well. We have an ability to tap loyalty, and we have the ability to threaten loyalty, and we need to be very cautious about that. So we love to point out problems with the system. We love to point out, some failure of the system. And I would submit to you that folks who are very conservative, when they hear us talking about how dysfunctional something is in the country, they feel a threat to their sense of national pride. And we have to be very cautious at how we approach that, because that's an important value for them. I want to give you one example of how you can show a terrible problem and yet preserve a basis for national pride. So this data comes from the Institute of Medicine, and it's talking about mortality rates, or I think of it as life expectancies. So we know that life expectancies for Americans are being cut 3 years short, or even worse, as compared to life expectancies elsewhere in the modern world. We know that. You knew that before you came into this discussion, is how I often put it. You knew before you came in today that American life expectancies are being cut at least 3 years shorter than those elsewhere in the world. But here's that data, our ranking against 17 peer nations. Here's that data by age. So there's children on the left, middle age in the middle, and 85, 90, 95-year-olds all the way to the right. And there we are, happily holding up the bottom of the chart, literally number 17 out of 17 in most of these age groups. The worst in the modern world, despite the fact that we spend twice as much as these other countries. Bad. Until something happens when we turn 65. It's astonishing. We turn 65, and gradually, country by country, year by year, we become the best in the modern world, and probably in the entire world. We become number one. So this only happens if we have many of the world's best doctors and hospitals and nurses, and we should be enormously proud of our delivery system. We have a great delivery system. We just don't let everybody in. And look what happens when we turn 65 and we let everybody in. It's phenomenal how good this system is. So let's fix that part of the problem. So get what I did here? I showed you a terrible problem, and yet I showed you a piece of that problem that demonstrates a need, a basis for being proud in our country. It's really important to give that lifeline, to give a basis for being proud. Authority, I didn't do it today, but if I have a slide that's got, at the beginning of my slides, I often show that there's a footnote at the bottom, and I'll point out that it's too small for you to read, but I'll go back to it actually. There we go. There's a footnote at the bottom of this slide. It's too small for you to read, but it's there so you can see my source, and if you need me, I can go up to the slide and I can read it to you. But if there's numbers on my slide, there will be a footnote. So I try to point that out. But I try not to overemphasize that there's a footnote with sources. I mention it, and then I move on and try not to mention it again. Because the more often you mention your sources, the more often you dwell on, well, this came from the New England Journal of yada yada. This came from, the more often you emphasize your sources, the more you're declaring to your audience, I am not the authority. I am here as a writer's service, bringing you to other authorities. And the more you're almost giving the message of, well, you're not the person I should be listening to. So have sources, make them available, but my point is, don't dwell on them too heavily. And refer to the fact, sometimes this is a compelling part of the argument, refer to the fact that something on the order of 60% of doctors today support Medicare for all, more in some specialties, less in others. But there's strong support for Medicare for all among physicians, and you can give more examples of that. And talk about how the faith leaders often support this. Use the fact that you or people you know are good authorities. And then lastly, tap into the sanctity, tap into the fact that we're extending lives. And so that's valuing human life. Keeping us out of poverty is protecting sanctity. So use these values. Another piece that I'd like to suggest to you is this idea of tribalism. So this is a terrific book that has brought this more to the mainstream. Tribalism is not just a new concept since social media and 24-hour news channels. Joshua Green makes the point that tribalism actually has been around for millennia, that our brains were designed for tribal life, that a tribe that didn't try to hang together and defend itself and its resources against other tribes would fail and die off. So there's been a millennia-long genetic selection for human brains to have a bias towards tribalism, protecting ourselves and fighting off the others. So that's not a new thing, and I've run into this all the time. I'm from Chicago, and I live in St. Louis, and these two cities are very proud of their baseball teams. And one of the first questions I get, of course, is this: Cubs or Cardinals? And, you know, the true answer is I don't follow sports very much, so I don't really care. but tribalism is sports. Tribalism is all over the Congress. That's what you're seeing left and right. Tribalism is common in the boardroom or at the Chamber of Commerce. So how do you use that? Well, I gave this talk at one more piece about how you use it. When you want to find a common ground and you want to get to an answer, somebody asks for something and you can answer, no, we can't do this, but we can meet you this far. So when you're looking for an issue, you could answer, no, but we could meet you this far. Or you can answer yes, and here's what that looks like. And you both get to the same exact position in the middle. Do we want to do this? Well, no, we don't want to do that, but here's how close we could get. Do you want to do this? Well, yes, we can, and then put constraints around it. And they both get to the same position in the middle. But if you start with no, if you answer the question no, but, well, then you're declaring yourself as outside of the tribe that you're being invited to. If you answer with yes, you're literally knocking, well, figuratively, knocking at the door of the tribe. You have taken empathy and actually weaponized it a bit. So yes is a lot better than no, especially when you're going to get to the same place. I gave a talk like this at the PNHP annual meeting in 2017, and Dr. Amy Evans was one of the people in the workshop, and we had time for people to practice it. And she came up with this one sentence that I just thought was genius. So I'm going to quote Dr. Evans. She said, as if she's speaking to the Chamber of Commerce, she said, most of you know me as the neighborhood pediatrician, but you may not realize I also run a small business. That's her opening sentence at the Chamber of Commerce. Most of you know me as the neighborhood pediatrician, but you may not realize I also run a small business. So in other words, you know me as the neighborhood, I run a small business, I'm in your tribe. Lakoff would have said nurturing pediatricians, and most doctors, but really pediatricians, have nurturing in spades, and tap nurturing automatically. Hierarchy, I'm the pediatrician, I'm the doctor, and the moral pillars, loyalty, I'm in your neighborhood, and authority, I run a small business, pediatrician. So in one sentence, she has combined a whole bunch of these messages, which I thought was kind of genius. One of the last things I want to take you to is this mantra of healthcare as a human right. So I confess, I used to be naive enough to start a lot of my conversations in grand rounds by saying, well, we all agree, right, healthcare is a human right. And oh boy, that didn't work very well. So the liberal mantra to is healthcare a human right, of course, is yes. And we can defend it, right? The World Health Organization's constitution literally defines healthcare as a human right. So we like that in the liberal side. The conservatives will react, really? Healthcare is a human right? Not so fast there, buddy. Where is that stated in the United States Constitution? I don't see it in there anywhere. Where's that in the Bible? And if it's a human right, so my patients can wake me up at 3 o'clock in the morning if they have something they want to talk to me about, because I can't say no to a human right. These are arguments that I've actually gotten into, these exact arguments. And it takes 10, 15 minutes to work through it. So I would say be very thoughtful with the phrase, healthcare is a human right. Is that really what you want to talk about? Do you really want to spend 10 of your 20 minutes discussing the ethical definitions of human rights? Maybe it's an interesting discussion, but you've only got so much time. You want to be talking about Medicare for all. This is an adjacent topic that you probably didn't intend to trigger. So you didn't even intend to trigger. This is based on fairness and caring, but you could have tapped loyalty, right? You could have done that, or prudence, or it's the common good, or it's, you know, get us the American dream. So I would say we could focus on it being part of the common good. I want my neighbors to have trash collection, sewage collection. I want them to have that. If they don't have sewage collection and trash pickup, my property values go down. It's a common good. Does that mean that my neighbors have a human right to have their trash collected at their curbside? I don't know. It's not a discussion I am prepared to even engage in. I don't know if it's a human right, but I do know it's a common good. just as healthcare is. It's to my advantage to make sure that the person serving me food in the restaurant or cooking the food or cleaning the dishes doesn't have coronavirus or some other, or tuberculosis. It's to my advantage to know that the person sitting next to me on the bus or in the movie theater who's been coughing can go to a doctor and be diagnosed with whatever infectious disease that is, and not be making the trade-off of, well, if I go to the doctor, you know, that's it for the next 2 months of what I can afford. No, it's to all of our advantage to have everybody involved in the healthcare system, everybody able to go get healthcare. Is it a human right? That's a discussion that I'm not expert at, but it is a common good that we all need to have. Last thing I want to talk about is the big trap. So here's from one of the first debates, and you may have heard these this question. Remember this question? Raise your hand if you want to abolish private insurance for a government-run healthcare. And they're still asking questions of that sort. And the crowd was really struggling with what to answer, because there are power words embedded in the question. Who wants to abolish private health insurance? Most Americans, most human beings don't want to abolish anything. They certainly don't want to get on a stage and raise their hand, I'm for abolishing anything. Some do, but abolish is a really hard word to commit to. And private? Really? Is our health insurance today a private system? No, your employer picks which health insurance options you have, if any, and if you change jobs, it's no longer yours. You've got to go to a different choice. It's not private for you. You don't have any control over that. So phrasing it as private health insurance is already setting you up for the wrong answer, and calling it government run, really, government run. First of all, it's actually not being run by the government. Medicare for All puts physicians at independent practice. You can practice wherever and however you want. The government is only falling into the background for claims management and paying the bills. And, you know, frankly, and nowadays saying something is government run is a radioactive hot button for some people. You've seen this more and more. So framing this as government run is setting you up to be on the wrong side, on a difficult side to win. And healthcare, they're comparing private insurance, a circumscribed product, almost a commodity, with government run healthcare, a broader thing. Healthcare is a big thing. Insurance is a small thing. So you want to abolish private insurance for government run healthcare. That's a really loaded question. When you're asked a question like that, point out that you are rejecting the premises in this, maybe even point out the bias of the premises. I would tell you a couple of other ways to talk about it. First, insurance is not private. Your insurance is corporate run, selected by your employer, outside of your control. And this shocks a lot of people when you tell them, but it's true. Most Americans nowadays, on average, change insurance every 18 months. Americans today change insurance every 18 months. You change jobs, your employer changes what they offer, you pick one of the other choices every 18 months. So really, you're going to call that private? No, this is corporate run, picked by your employer, outside of your control, and changes frequently. Reject the premise that insurance is private. Likewise, reject the premise that people love their insurance. Forbes magazine recently told us that the health insurance industry is the fourth most hated industry in the United States. People don't love their health insurance. They hopefully love their doctor. They hopefully are pretty happy with their hospital. They don't love their insurance. That's a myth being propagated by the very people who are claiming that they're loved. The insurance industry is the one saying that people love them. And I'm here to tell you, Forbes magazine identifies nobody loves their insurance companies. And try this on, stop wasting our money. Medicare for All is the far less expensive option than the status quo, according to now 30 as of today. There are now 30 studies that demonstrate that Medicare for All is at least break even and generally less expensive than the status quo. And the Koch brothers' own study said that Medicare for All would cost so much, but that large number is smaller than the status quo. So don't fall for that. So the key tools: first, loss aversion instead of gain centric. Secondly, try to use yes, no instead of no, but, yes, but instead of no, except. Think about the quadrant somebody's in, forms, futures, feelings, facts, and try to stay in their quadrant at first. Try to activate the frame that you want, typically the nurturing frame. Use your listeners' moral pillars. Get into loyalty and sanctity and use some of your authority, not just the ones you're comfortable with. Make tribalism work for you, and be careful when you use terms like human rights. I'm not saying never make a human rights argument. I'm saying the human rights argument works when you're trying to bring out the liberal base. might persuade some independents, but is frankly a bit offensive to people on the more conservative side. So think about that. And of course, join Physicians for a National Health Program. If you're not in yet, you can sign up for free for emails for free. You can, med students can actually join the organization for free, and you can follow the group on Facebook. Thanks.